All right. So, welcome to the second episode in this webinar series, The Unlearning of Child Welfare. If you attended the first episode, well, welcome back. Super happy that you guys could be here with us today. My name is Jaquia Wilson, and I am an advocate for youth, a professional in the field, and an alumnus of the child welfare system. And here with me, co hosting, is my wonderful ally and power, Sandra Gasca Gonzalez. Hey, Sandra.
Hey, Jaquia, it's good to see you.
Nice to see you too. I'm so happy you could join us today.
Thank
Um,
you.
so yeah, I just want to recap a little bit and share with our newer attendees a little bit about what the Institute is. Overall, the Institute is a brand new platform where parents and professionals can come together to elevate family well-being, and this is all families. I'm not just families in the child welfare system. So, in our last episode, we introduced to you all the idea of unlearning child welfare language and reinventing that with something like family well being. Honestly, Sandra, I was struck by the communication that took place on the first episode. The conversation was powerful. Thank you so much to the willing participants on our panel and to the audience for being so engaging. We really got a lot out of what you all dropped in the chat. We really received a lot of positive feedback and eager people all over who share the same vision of shifting to a family well-being focus, and that excites me. It excites my entire team. So thank you all so much for being here. Sandra, did you want to share a little bit about your reflections from the last episode?
Yeah, thanks, Jaquia. I've been thinking a lot about like the first webinar and why we are even talking about this. And I think you and I have talked about this, but one of the reflections that I was having that Sharonda, I think, actually landed in the first webinar is about the conditions that families face and how we need to unlearn that it is not the case that we always need a service or an intervention fix, because addressing conditions family are living in requires something different, something that doesn't exist. And so for me, like I was really sitting with that we're so service driven, so intervention driven, and where the power really is in listening to families, listening to young people, and hearing what their solutions are. So that's what struck me.
Awesome. That's amazing. Gosh, I know a lot of things really hit home for me, but I definitely left feeling like I learned or unlearned, rather, some of the practices and things that I've experienced throughout my experience in care. And so I'm super excited about that.
Yeah, one of the other things that struck me, and I thought people were really vulnerable about, was the whole issue around race equity
Oh,
and
wow.
around how what are people, professionals, individuals who are in this work, what are they doing to better equip themselves around bias, explicit, implicit bias. And so that was another thing. I felt like we started to touch the surface, but
Hmm.
because of time couldn't really go as deep as I think we both wanted to go.
Yeah, I think that really just leaves us with the question that we are trying to really help answer today, and that's the how behind a lot of what we're doing, and how do we plan on moving forward and seeing each state kind of take on the same vision and having a family well-being focused child welfare system. And that's another thing that Sharonda really hit on. She was like, language is really important, and child welfare is not the right language. Family well-being is the entire picture, and that's where these children come from. So we really need to work with those families and elevate them and empower them to be as great as they can be. So I'm super excited to learn from all the wonderful panelists that we have today here.
Yeah, so should we go ahead and dive in? Get
Yeah,
this show on the road?
let's
Okay.
introduce them.
All right, let's move on. Okay, so I just wanted to remind everybody that the Institute for Family is sponsoring a three-part webinar series on the unlearning of child welfare. And today is the second of those three. Webinar one, as we just talked a little bit about, was about why we should create a child and family well-being system. And today's webinar will really focus on how some places are already taking up the work in different ways. So you're going to hear both Colorado and Nebraska as examples of what they're doing. Both of these states are a part of the Thriving Families, Safer Children effort, which is a national commitment to well-being that really aims to move from traditional reactive child protection systems to those designed to support child and family well-being and prevent child maltreatment and unnecessary family separations. And you heard about that at the last webinar. But both of these examples are also a part of local efforts, the Rewiring Collaborative in Colorado and the Bring Up Nebraska initiative. You'll hear about those. So today you're going to learn about early indicators of how we can begin to build a family well-being approach from the ground up. You'll also learn about some emerging family well-being efforts across the country from one of our panelists. And so that is what today really is. It's a conversation. We intentionally wanted to have a dialogue. It won't be a presentation. And we want you to learn from the various perspectives about how to make this shift. And to help us do that, we're ready for the drum roll, right, Jacoya? We have a great panel, and I'm going to introduce them right now. We have with us our fearless leader, Matt Anderson, who is the director at Institute for Family. We have Bobbi Taylor, who is a Strengthening Families coordinator for the Nebraska Children and Families Foundation and a Jim Casey Young Fellow. We have Ned Breslin, who is the CEO of the Tennyson Center for Children and also the founder of the statewide collaborative called Rewiring. And then we also have Clare Anderson, who is a senior policy fellow at Chapin Hall. So I think some of you are expecting Susanne Shore, who is the First Lady of Nebraska. She's listed as an attendee, and we may have her here. We're trying to figure out if she's having technical difficulties, but if she joins, we will definitely stop and introduce her. But I want to welcome all of you and thank you for being here. So now that you know who's here, we want to start by asking you, the audience, a question. So get your fingers and your keyboards ready. All right, so we want to take a quick poll, and this poll is a yes or no poll. And the question is, are you actively involved in leading child welfare transformation efforts in your state? So it's yes or no. And if you are, drop in the chat what you are working on specifically, because it would just be great if we could get a sense of what you're actually focusing on now. So I'm going to give you a couple of seconds to do that real quick.
Hoping we get a lot of yeses.
I hope so. And if we don't, well, there's lots of learning here that can happen. Okay. So yes, 57% of you are already involved in some type of efforts. And it looks like there's a lot of FFPSA, Family First Prevention Services Act, ICWA implementation model, implementation, Safe Families for Children. I see Kansas is up to something, but it's moving so fast I can't read it all. So Indiana, great that you all are working on things, and I just want to thank you all for participating in that. And Jacoya, how about we get moving with our panel?
Yeah, as Sandra mentioned earlier, there are a lot of initiatives happening around the state to really help us learn and understand how we can do this work a little bit better to service our families. We've mentioned a number of initiatives, and now we want to get into it, asking our panelists a little bit about what they're doing. So I'm going to start with you, Ned, if that's okay, and just ask, can you give a brief overview of Rewiring and Bring Up Nebraska? Like, what are these initiatives and what exactly are you trying to accomplish? Like, what personally motivated you to take on this work? So I know it's a loaded question, Ned, but I know you have a lot to say. So I'm going to pass the mic to you.
Well, thank you so much. It's such an honor to be here. what motivated me is I joined Tennyson about 3.5, 4 years ago, and we're a pretty small and traditional child welfare provider. We have a residential program, we have a community-based program, we have a day treatment program, and great staff, great program, great history. We've been around since 1904, and all the kids who come here are amazing. They're, I was just with a kid who was in our residential program for a while. He's now in a foster family, but the school wouldn't let him in. They thought he was too risky. And he's 9, and he's upset about that. And he is pounding away educationally because he's going to prove to that school that he's worthy. And it's shocking that a 9-year-old has to prove that they're worthy. But what's particularly galling about this is that even though he was in our residential program, if you look at his case history, the thing that makes me so sad is if someone had actually moved earlier, he wouldn't be at Tennyson. He wouldn't have been in our residential program. And while I'm thrilled to know him and I love him to death, I wish I didn't know him. I shouldn't know him. And so that's what drives me. Rewiring is a very simple idea. And it basically says, and it frames the work in terms of impact and outcomes. And so it basically says the sector, child welfare, whether it's state, local, national, is spending an enormous amount of money buying terrible outcomes. And what we keep doing is trying to pound money different ways and add services in different ways. And we're still getting abysmal outcomes. We're still getting kids like the kid I talked about coming to Tennyson. The other thing that's galling about it is if you talk to any caseworker, they will sit there and they will say, I saw this family today and they're in real trouble, but you know what? I can't do anything. They haven't met medical necessity or imminent risk qualifications. I can't figure out how to move funding. And so I have to wait for them to fail. That's immoral. That's absolutely immoral. And so caseworkers have that story all over the country. And so rewiring basically said is, well, that's nuts. What would you do if we actually eliminated the problems of medical necessity and imminent risk as a funding line, and anything below it you can move, but anything above it is kind of harder to move? What if we said, we're going to buy different outcomes? So we're going to invest programmatically, financially. We're going to invest to see if we could dramatically reduce the number of children and families who become child welfare involved. Mm-hmm. And we're going to see if we could get better results for the children who are child welfare involved because of that. And the rewiring part is to understand how money moves so we can go to legislators and budget writers and say, move the money this way to buy these outcomes instead of continuing to move the money this way and buying garbage outcomes. Mm-hmm. So we started it in Colorado, and a lot of heroes in this story, but it was co-designed by this colleague of mine, Tiffany Perrin from the Zoma Foundation. A lot of people sit around and say, donors want to get involved in the design and everything. This is a perfect example of it. Tiffany co-designed it with us. She was so impactful that we actually convinced the donor to give her to us for 3 years so that she could actually see the impact of her work. And then we went to the Joint Budget Committee, where another gifted magician, the budget analyst there, Robin Smart, who cares about kids more than anyone I know, basically said, let me see if I understand what you're saying. You're saying you're going to use philanthropic dollars to show how money moves differently to reduce the number of children and families becoming child welfare involved and get better results in the counties that we work with. I need you to work in these 10 counties. So we identified 10 counties across Colorado, east, west, north, south, Republican, Democrat, high density, low density, diverse, not so diverse. And she basically said, if you can show me that you can get better results moving money, then I will help you rewire the money. And so we started. We did it a year ago. We started about a year ago. The 10 counties are unbelievable. And we basically said, we're not going to make you over plan and do a proposal and do all that stuff. It's iterative. What are the drivers in your county that are leading to child welfare involvement? And so counties sat back and they said, well, in our county, it might be prenatal moms, substance using, who we don't want to do that anymore. And substance treatment programs aren't solving the problem. Or it could be third graders, fourth graders, seventh graders, 10th graders in our schools who are starting to struggle. So all these counties came up with these ideas of if I had the ability to invest, I would go here. They've done 5 things across these 10 counties. They have built programs that reduce isolation. So they've invested in some crazy things. One of them, my favorite, is called Granny Armies. It's basically rural communities that are never going to have enough social workers. But what do they have? They have grandmothers, and grandmothers are trusted, and grandmothers have lost their sense of purpose. And so we're now matching grandmothers with prenatal moms, and they will stay with those moms till they're 5 years old to make sure, till the kid's 5 years old, so that those kids don't become child welfare involved. We have massively invested in basic needs: housing, transport, childcare, all of that. Anyone who's non-TANF eligible but is struggling and child welfare has seen them, we're moving on that. We have 2 counties, Denver and Larimer, who've identified the zip codes in their counties with the highest referrals. So instead, in those counties, instead of going and saying your family's got a problem and your family was referred, you sit back and facilitate at community level. Why are there so many referrals here? And you finance local community-based organizations who are trusted, who are known. They don't like Tennyson. They don't want to see Tennyson. We're investing in other organizations to do that. Amazing triage work in Douglas County. Real hats off to the Douglas County team. One of the biggest drivers into child welfare are schools. And so what they've done is put a layer between the schools, because when the schools don't know what to do, they call DHS. So they put a layer between the schools and said, call them first and let's see if they actually do need DHS or they should go somewhere else. And so COVID has affected that program, but when it started, you went from this many referrals to DHS to that many, because they were able to triage them and move them to other places DHS never saw them. It was beautiful. Last thing is medical necessity and imminent risk work. So we've had organizations like Tennyson and Savio take in Douglas County. There are 2,000 families that Douglas County DHS sees. They estimate 48% will be child welfare involved in 2 years. That's 960. Give us those 2,000 families. Let's go work with them, and let's see if instead of 960 families, we can get it down to 50 or 40 or 10. We then frame all of that work in terms of cost avoidance. If they had become child welfare involved, what would that have cost? It's $14,000 per case. How much are we saving by cutting the number of children and families who become child welfare involved? After a year, 0 families that this program has worked with, 0 have become child welfare involved. That is telling. The second part of rewiring is to say we got to get better results in the system. And so real quickly, what we're doing is we've jumped all over the QRTP work. We think the most brilliant part of FFPSA is the assessment link. And we set up a program that said, stop putting kids in residential. Any kid that you're worried about, you can put that kid in Tennyson for less than 30 days, but go find a family. Go find a family, and let's not put them into res. So we started with a pilot of 6 kids. 4 went to kin, 2 went to foster, 1 went to foster to adopt. And we built out this model that is going to save counties. Denver County, if they just use this program, instead of using our residential program, they will save $380,000 a year. So then the question is, what do you want to do with that money to get upstream to get fewer and fewer kids in? We've also been tracking, just last thing real quickly, we've been tracking spin-off impacts. So we've seen a 95% reduction in police contacts. That's a $75,000 savings a year. We've seen a 98% reduction in hospitalizations. That's a $297,000 a year savings. And so we're now sitting with legislators and Medicaid and saying, move money this way, you will get these results, liberate everyone, and we can get to a better place. We do this in partnership with a couple of things that I'm really excited about. 10 counties who are amazing. They are coordinating with public health, housing, other institutions that they've never done before. We are thrilled with the Colorado Partnership for Thriving Families. We are in complete sync coordination. That's the program you guys were talking about. So what you have is this amazing coordination and support to build out this continuum and to build out a new world where kids and families are not child welfare seen. And it generated so much excitement because people are talking about it, to be honest, and it is exciting. that 5 states in the Children's Home Society of America network, North Carolina, Illinois, Florida, Mississippi, and Washington State, have said we're going to do rewiring too. So liberate people from the financial and programmatic constraints. Do exactly what Sandra said in the beginning. Do not constrain yourself to evidence-based practices. It's a Linus blanket. They're needed, but it's evidence plus. And be driven by the outcome of fewer children and families in the child welfare system. Calculate the costs and go to budget writers, to Joint Budget Committee and superstars like Robin Smart. Go to federal level and say, stop buying bad outcomes this way, invest this way, spread it, create new billing codes, and you will stop the flood into child welfare.
Wow.
It's so fun.
I mean, where's the applause button? We don't have them on here, but that's right. And look who we have, Susanne Shore, the First Lady of Nebraska. We're so happy you're here. We figured you'd join us eventually. Susanne, just by way of introduction, is the First Lady of Nebraska, but she's also a major partner in the Bring Up Nebraska initiative. So we're gonna go to you next, right, Jaquia?
Yes, I just love what Ned was saying, and I heard this common theme that we also heard on the first episode about not just giving out services, but going to those communities and those counties and asking them what they need, and that is just really powerful to me. So I am happy to have heard that. Susanne, would you like to share a little bit about what you all are doing?
Sure, I'd love to. So I really don't have a whole lot of time to explain how prevention became a priority for me or how I got involved with this work, but I'll just say this, that I knew enough to actually ask my husband to run for governor in order to improve child welfare in our state. That was 100% my motivation, and I'll just end it at that. What came out of that was Bring Up Nebraska, which is a community-based prevention program that focuses on keeping families together and as many kids as possible in safe and loving homes. And with Bring Up Nebraska, the focus is local solutions. We've taken a really different approach where we no longer rely on that top-down, one-size-fits-all system that we had here, where basically the state makes all the decisions and just tells the local communities how to solve their problems. And instead, the focus is on local communities, because we really believe that they are the best situated and most motivated to understand their own strengths and their own needs, and then the best to create the networks and solutions necessary there. So the core for Bring Up Nebraska is really that individual community. And within that community, the collaboratives come together, and they're made up of nonprofit leaders and service providers, elected officials, business owners, healthcare providers, educators, law enforcement are a big part of it, community and church leaders, and of course, parents and youth. And from the beginning, each collaborative gets together and starts analyzing its specific issues, problems, and strengths based upon data that's provided by the Nebraska Children and Families Foundation and Casey Family Foundation. And that data is so important because that really drives what they're going to work for. So the collaboratives start talking, and everyone starts talking about what they've been doing, because so many times the folks were working in silos, not even knowing what other solutions were out there. And they start looking for gaps and overlaps in services, and then they develop the network strategies and long-term plans to work on those specific issues. Now, these could be on homelessness, the need for affordable housing, some work on graduation rates or third grade reading levels. It could be for the need for quality childcare, unemployment rates. We don't define or direct what those are, the communities decide. They're just given their metrics in comparison to the rest of the state, and then they start solving those problems. And then they start solving another problem and another problem. And the state partners are there with them, often sitting in the same meetings. And I won't go into all the list of agencies, but basically it's almost all of them, not just HHS. It's state and federal foundations and organizations that provide technical and financial support. It's Nebraska Children and Families Foundation that provides expertise, data, and resources. So everyone is sitting in there together, and all of us are there to support those communities. And sometimes we might provide expertise. Sometimes we might provide connections to other communities that have helped already seen and help them solve those problems, or to a specific person in a specific department who can help. And sometimes it's with flexible dollars, either from the state or from private partners. And now we're excited to be a part of the federal Thriving Families Safer Children initiative. We have found motivation, inspiration, and resources to really push the program into becoming more comprehensive, into becoming a community well-being system that supports family and children with even more services and partners and addresses more systemic problems. And what we've seen, when I started this, I wasn't exactly shooting for the moon. I just kind of wanted to make things better. And many of the issues that we're working on can't be measured in 2 years because the communities are working on their own specific strategies and solutions. But one thing I can say is that Bring Up Nebraska in its first 2 years has decreased their home removal rates by 14% in 2 years. And that's no negative impact on the CFSR indicators. We have a long history of relying on removal from home as a chief tool in dealing with any kind of challenges that are going on within a family. And we're really starting to shift that. And that's the communities. That's because those communities are providing the upfront prevention services to help families before they get involved in child welfare and juvenile justice. So as I've said, Bring Up Nebraska and the collaboratives are about community well-being in order to care for kids and families. The value and benefits are astonishing beyond just what I just said. In 2019, the majority of our state experienced massive, devastating flooding. And the collaboratives were the groups that stepped up from the beginning with FEMA to manage those recovery efforts in their areas, to the point that FEMA said they had never seen any kind of work like this before. But it's because the collaboratives were already there working together. And now with COVID, again, the state has relied on them for information, leadership, and solutions. And I just can't overstate their impact. The work of the collaboratives has helped the governor direct CARES dollars. It's guided state leaders as we develop multiple task forces that deal with systemic issues, including mental health, food security, and housing. And these are long-term solutions. We really are building back better because of these collaboratives. It's hard for me to believe that focusing on individuals in prevention is anything earth-shattering, or that it would have such a positive impact on Nebraska. But it really has been hard to explain how important this work has been. And I'm excited to be part of that Thriving Families Safer Children initiative, because now we can expand our work even more. And I hope that we can serve as an example, possibly a model, for what can be achieved throughout the US. And if nothing else, we're here to spread the word that prevention works. And if you ever need anybody from Nebraska to help sell it, we're here, because we can really talk about what's been achieved. So thanks for letting me be a part of this.
Thank you so much for all that concrete information and those powerful numbers that Ned shared. I'm just, like I said, hearing the same common theme around communities and putting them in the driver's seat and really watching them show up and stand out for those families that are in their communities. And I'm just really excited. These are very concrete ways that all of our listeners can really see how we're doing the work and how it's showing a great impact. So with that, I want to go to Miss Bobbi and ask, can you talk about the site support teams that you work with and the role of parent and family leadership? Why is it important that we co-create with families in this work, a different system?
Yeah, so we could go into further dialogue. I want to be kind of short and quick, and I really want to focus on the importance of including families and lived experience. And I know this to be true, that families and lived experience are the secret sauce. to creating a community well-being system. I mean, you got the mayo, which is the base of the system. You can add ketchup, which is the agencies and departments. You can add a little mustard, which are community service providers. But it's something about that secret seasoning that really elevates the sauce and really transforms the dish. And I believe that families and lived experience are really that secret sauce. And so when we're incorporating lived experience in families in a co-creation space, it's so important because they're going to be able to lift up the systems or the symptoms of a broken system. For example, they're going to be able to provide a qualitative data that quantitative data is identifying. And a very tangible thing that I can use as an example is housing. So it's known that there's a housing crisis right now. But when you incorporate lived experience into those spaces, those co-creation spaces of identifying that housing, you're going to get families that are going to come to the table and say, hey, listen, one of the barriers that we're really experiencing right now is the application fees. The application fees can come from $35 to $50. And with the family with a very, very tight budget, it's not really feasible to spend $200 on application fees. It just isn't going to work. When you're incorporating a lived experience person from a foster care lens, they're going to say, hey, we don't have credit and we don't have a family support system to really co-sign to get into housing. We don't have that support system and we're not financially capable of doing that. Another role with the lived experience is really demonstrating equity and inclusion in those spaces. When you look at a Nebraska table where a lot of system leaders are, they may not be affected by the disparities that a lived experience person is. And so lived experience can provide insight and perspective on those disparities. They're going to be able to speak to, the disproportionate effects or marginalization or direct biases that they experience. And through inclusion of those perspectives, that's when we're really going to elevate and be able to create a community well-being system.
Thank you. That was powerful. I think everyone is super excited about hearing from the secret sauce herself. So that really made me happy to know that I am also a part of the secret sauce. So thank you so much, Bobbi. That was very well spoken. And so Sandra.
Yeah, I love hearing the term secret sauce, but I wish it wasn't such a secret because this is what's needed. It shouldn't be a secret. And now that we know now that we know about it, it's no longer a secret. So we should all be using that. But I just love hearing about your leadership, all of you, the leadership roles that you've taken, the vision and the coalition building. You're really demonstrating that the efforts you're already taking even early on, like for Ned, for you, it's been fairly early. Bring Up Nebraska has been going on a little bit longer, but we're not talking about 10-year initiatives. We're talking about 4 years, 2 years, a year, and you're already seeing amazing results. And so we love hearing about that. We've heard from Bobbi about the role of youth and the secret sauce. And it sounds like you're really working towards shifting your perspective from intervention and services to family resilience and concrete support to address conditions families face, which was something that was raised at the last webinar. And I just want to ask you all, what are those challenges and risks and opportunities that you've had? And we're also seeing a lot of questions in the chat about ICWA. So could you speak to how your initiatives are working with Indigenous communities? And Susanne, I'd love it if you could go first.
Sure. So I think some of the reasons that this has worked for us is that kind of all the stars were aligned for us, that we had a naggy first lady who was willing to push the governor and a governor who had the insight to want to make this a priority. I can't emphasize how important that has been to making sure that this is successful. But then we also had funders and foundation members who really wanted to see that kind of difference and had that vision. We've been the guinea pig, so hopefully other people can point to us and we can be that role model if you need other people to be inspired, whether it be your governor or other foundations. Some of the challenges that we see is making sure that this sticks around long term, even after the next election for governor. Any kind of governmental change can always mean there's the priority change, and we wanted this into the system so hard that community sees the success and that it's solidified. We also, there's also always the risk of emotions getting involved when, for instance, we see a horrific story about child deaths, and all of a sudden there's a knee-jerk reaction that people say, oh, the pendulum's gone too far towards prevention, but we need to be prepared for that and ready to explain that that's a false choice, and that prevention is a big tool that needs to stay a part of our box. We need to expand more into businesses, smaller community funders and foundations, and also involve the judicial branch more and more governmental agencies. For instance, Department of Labor. When we go in and see a family is struggling to pay its bills, don't just help them pay the bills, but then make sure that they get on the Department of Labor's radar so that they can get training. And then as far as our Native American communities, that's been an ongoing challenge for us. And a lot of it has to do with needing to build the trust, which we've been working hard to do. It starts with building that trust and understanding, and for those outside of the community, understanding that we need to step back and not be the experts. And I think we've been working hard to do that. And Thriving Families Initiative is really a huge opportunity for us because we're looking to prioritize that expansion into those tribal communities. And again, it's making that investment, the support, building the trust. So hopefully within 1 year, the work that we've done, I'll be able to report back that we've seen even more success.
Yeah, we'll look forward to that. I think you're spot on with trust and understanding of the just customizing the way communities want to have their own solutions, and us not imposing those values that we might hold. And Bobbi, I'm curious from your perspective what you see
as a challenge. To be quite honest, I see a lot of challenges, but that comes at the foundational level of relationship building. As we see lived experience being included in spaces, I feel like it's kind of drifting towards a trend. There are amazing organizations that really honor that power sharing and really honor that partnership. But as I just see in a lot of other different spaces, lived experience becomes a check in the box. And I just have to be honest that that's not how it's going to work, right? We really have to be intentional about those relationships that we're building, because that's going to set the tone for the solutions that are going to be created. Another thing that I see as kind of a potential barrier is that systems leaders and systems in general really have to unlearn that authoritative role that they have. It's really easy for them to set those agendas and find a lived experience person to plug into that agenda to carry it forward. Or it's another check in the box where they're like, okay, we have lived experience. It doesn't really match our agenda, but we're going to push our agenda anyway. And we're still going to just say like, we have lived experience. So we're saying, we can be inclusive. And that's not how it's going to work. When communities and systems are implementing that inclusion space, I can't stress enough how important it is to really center those relationships, meeting people where they're at, making sure they're equitably paid and compensated, understanding that, if a parent has to find a babysitter to contribute to a system's change, there may be a need for, a child care payment, right? To help them and meet them where they're at. They're being very vulnerable and exposing some of their truths that are not easy to expose. And so we have to honor that. And every other professional in that space is going to be paid to be there. So it's important that we do that for them too. And that's just a small example, but again, I just have to stress the relationship building, because communities with lived experience are just as important as other stakeholders, in which you would spend a lot of time fostering those relationships.
You know, Bobbi, as we introduced you also as a Jim Casey Young Fellow, and that means that you're an advocate nationally for youth who are transitioning out of foster care. And just a quick plug for people out there, that the initiative actually does measure authentic youth engagement twice a year to see how young people, if they feel like their voice was heard, and there are questions that can be shared that as you're building up these efforts, you can start to measure whether young people feel like they are being authentically engaged and their ideas are being taken up. So I just wanted to just share that. And Clare, we want to get you in here. We know your role at Chapin Hall. You get the purview of the whole country, and we'd love to hear your thoughts on challenges, risks, opportunities, just what you're seeing across the country.
Sure. Thanks so much, Sandra, and thanks everybody. I'm just delighted to be here. I'm going to try and tie together a few dots and connect them, because what we are seeing at the national level, Sandra, is this real interest as states have deepened their planning and initial implementation of Family First, a real hunger to figure out, how do I go further upstream into the prevention space? And as Thriving Families, Safer Children, a national commitment to well-being movement is embarking on new dialogue with the states, I think we've experienced a tremendous appetite for looking for ways to not just change the narrative, to change the perspective, to change the constructs, the relationships, and the ways in which we engage with, serve, and are in service to communities and families. And so what I think Ned said, states are looking for evidence plus. I really like that. I wrote that down as you were talking, because I think states really are trying to figure that out. And what I want to use my time to do is to connect that plus, what I think one component of a family and child well-being system can be, addresses, Bobbi, your statement that families have tight budgets. And when we listen to families about what they need, one of the first things that we hear are resources, concrete resources, fiscal, economic resources. And so I want to highlight a few studies that are emerging right now that we didn't have even 5 years ago, that lead us to think about economic supports for families in ways that I think we have not until now. So as you look at the amount of money, Ned, to your comment, we're spending a lot of money on a set of outcomes. We're spending somewhere in the neighborhood of $30 billion a year across federal and state funding streams to identify and address and treat child maltreatment, predominantly in an after the fact engagement with families rather than in the prevention space. And as we think about moving money, there are various ways to do that. And I want to highlight a few policies that already exist. It's not everything, but it shows a pathway, I think. So the studies that I'm referencing show that if you provide even modest economic supports to families, you have a pretty significant reduction in child maltreatment and neglect and in engagement in child welfare. And when I say modest, I mean modest. The earned income tax credit for states that have a state level EITC and provide $1,000 is associated with up to a 10% reduction in child protective services involvement for single mother families and with larger families. That's not much in terms of resource movement And that's a state policy choice to have a state level EITC program or not. Minimum wage, if the state chooses to increase the minimum wage even by $1, for every dollar a state raises the minimum wage, you get somewhere in the neighborhood of a little less than a 10% reduction in neglect reports. And these are just a couple of examples. States that expanded Medicaid also saw reductions in reports of neglect, particularly, and this is really important, for kids under the age of 6. So we have already in place pathways through which states can make policy decisions to resource families in ways that are important and meaningful. These aren't the only pathways. We've got to find other pathways. But the power of this new evidence says that even for very small amounts of money, we can stabilize families and reduce neglect and reduce involvement with child welfare. And I think that is incredibly powerful. So when we, as a practitioner, look for interventions with families, one of the first things that I should pull out of my toolkit is, what are the economic supports that are available in my community, in my state, and how do I get them to families? And if there are not as many as I want, how do I advocate for a different, more robust set of economic and concrete supports for families? So I think what we are finding is that it's possible. There are new pathways that we've not thought about in this context that I think that we could and should be. And I think these are also pretty powerful race equity and social justice strategies, given our long-term systematic deprivation of families of color and communities of color when it comes to economic resources.
Claire, I want you to know you brought a lot of joy to the audience. The chat is on fire and asking for the studies, because I think people need the information. We're talking about a $30 billion industry.
$30 billion, Sam.
$30 billion industry. And you're talking about small amounts of money that families need that would provide them with the concrete supports to prevent further exposure to the system. And Ned, I saw your head just shaking like you were in agreement. Yes. And so I want to go to you, like react to Claire, talk to us about challenges and opportunities. Also, there's a lot of activity in the chat about ICWA. There was a comment about how practices under ICWA about relationships and prevention should be the gold standard for practice. And so, like, if you could cover,
sure,
go around the way, that'd be great.
Sure, let me do that one first. I think Rewiring, one of the counties chosen was specifically because of the large Indigenous community. And as Susanne said, the First Lady said, that takes time and trust. But I think what's interesting is also there's an enormous Indigenous community in Denver, Colorado. And so we're finding ways through community-based organizations to support those community-based organizations, to work with them, because frankly, it is not our place. We can, finance and support it, but we are not the key role player at all. And I think that's good. I think a lot of the challenges, a lot of people tend to focus externally, and I think those are all real. I'd actually like to focus internally. I think there's internal challenges to this, and maybe some lessons from Tennyson. So first of all, it required a complete overhaul of our board to go here. And I don't think anyone should underestimate the importance of board leadership. If you're going to make a move that fundamentally threatens your historical business model, if you will, you got to have your board behind you. And I have the greatest board I've ever had in my life. I'm so blessed by that. Second thing is, you have to sit back and kind of humble yourself. Tennyson does amazing work and we are really proud of it. But the fact is is that children and families who have passed through Tennyson are also homeless, incarcerated, unfortunately have died by suicide. And we have to own that because we're part of the problem. We're trying to change the system, but we're also part of the problem. And so we have to have a much deeper sense of humility as we work, to not think that it's everyone else's problem, it's our problem. Third is we are an organization that has deep racial challenges internally, operating in a racial context and in a oppressive context. And we have to own that as well. And I want to tell you that is a really important step. 84% of Coloradans are Caucasian, white. Less than 40% of the kids and families who come through Tennyson are that. So that is outrageous. And Rewiring is really focused on stopping that as much as anything else. And that means, to Bobbi's point, is we have to find ways to invest in organizations that the child welfare sector never invests in, right? We have to invest in community-based organizations that are doing amazing work and are often unseen and unthought of because they have bigger impact than us. We also have to look at ourselves. The children at Tennyson of color are writing a Bill of Rights that is going to be presented to the entire organization in 2 weeks. And it's strong. It's really strong. We also have to deal with microaggressions, and I'll just give you one. You probably notice I'm handsy, I'm passionate. I am rewarded for that. We have staff whose performance reviews tell them that they're too handsy, they're too emotional and all that stuff. So I'm rewarded and they're told to tamp it down. That is outrageous. So we have to clean up our own act and get our act together if we're going to actually champion it.
And Ned, is that because they're people of color and you're a white man?
Yes, absolutely. And so we have to walk into that messiness because we cannot change the system if we can't change ourselves. Last thing real quickly, I think the biggest lesson and challenge of Rewiring, and I want to shout out two real amazing people, Megan Vogels and Clare Morrow. Rewiring is this amazingly ambitious program run by literally two people. And what we've had to do as an organization is to stop thinking that every problem requires Tennyson to build a program, build a service, build some sort of thing to solve the problem. We have had to become facilitators that say we are actually, in many cases, the worst option for that solution. And so they have had to go to shift to facilitators and enablers of others and to push the boundaries beyond the traditional, people that the sector invests in. So we just had a meeting recently, a woman from a community-based, Latinx community-based organization started crying. She said, no one's even seen us before and you've invested in us. And I promise you that nobody from my community is going to become child welfare involved. That's the kind of trust and that's the kind of courage, because organizations like Tennyson, if this works, we might not exist. Do we have the courage to go there? And if we don't, stop playing. Stop playing. We are building an organization that is infused with lived experience, that is empowering people that we don't normally see. And we're saying prevention is a job. It's based on not strengthening families. Families are strong. Find their strengths and build on those. Stop thinking of them as a problem. Unleash them in new ways, and we won't see them. And then I'll sell this property. I'll sell it for what it's worth and donate it. Because at the end of the day, you see these pictures on my wall. These are from kids who've been through Tennyson. I want a blank wall. I want a blank wall. And that's only going to happen if we change first. It's not everybody else. We have to change. And I think that's the biggest challenge at Tennyson.
Wow, Jaquoia, I'm never speechless.
I'm very seldom, but Jesus, that just shook me to my core. I am excited that we have had this conversation and this dialogue and on such a good platform. Oh my gosh, Sandra, what do you think?
Well, I think that I agree with some of the comments in the chat. Ned for president is one of the things. I'm just, I'm sitting with a lot of what all of the panelists are saying. Just the word that comes to mind is courage and humility, like being able to be humble and knowing that you don't know, and making sure that you're, Ned, I don't know how you said it, but you said just don't play. Like if you're not going to be in it, just don't play in it. These lives aren't meant to be played with. Their families are strong. It's us that's the problem. I just think that's all very powerful. And I think we could just keep talking, keep going, right, Dequaya? But we're almost out of time.
Yeah, yes. And I think we have talked ourselves out of a job. So
Yeah, I
it's a
think this
good
is our
thing.
last gig. But I do want to just quickly say thank you to all of you for what you've shared and offered. And I know there's so much more that you have to offer, but I want to turn to the audience because we want to get some audience feedback before we run out of time. And we're going to put up a poll question. And this question really is around if you were to continue if we were to continue the Unlearning of Child Welfare as a series, which of these ideas would you want us to do? So there are, and you can check as many as you would like. So would you like a closed Facebook group to continue the conversation, a follow-up webinar series similar to this? Or we've been thinking about an invite-only masterclass with leading experts. So like where we would have Susanne, Ned, Bobbi, Clare, and you could have more interactive one-on-one with them. I know that they've offered to make themselves available, but this would be in a more organized way. And then a podcast to hear more ideas and to learn more. So if you would please check as many as you'd like, that would be great. And I think we're going to post those in just a second. And as we're doing that, I would just add that if there are other ideas you have on how to continue these efforts, please put those in the chat as well. We'd love to hear that. And with that, I'm going to hand it over to the guy who got us all into this, Matt Anderson, for a wrap up.
Yes, thank you. And there is really not much left to be said. I've just been in the background listening, and this made my day, maybe my week, month, and year too. I'm just leaving this conversation really inspired and grateful, not just for the conversation, but for everything that each of you are doing that brought you to this conversation. You're doing really, really important, courageous work, and you're doing it for the right reasons on behalf of families and communities where you live. And I'm inspired. And so I want to say thank you to Jaquaya and Sandra for facilitating such a great conversation. It's not easy to do, and you both do it incredibly well. So thank you. And Ned, Susanne, Bobbi, Clare, thanks for bringing your brilliance and wisdom and energy and the sauce and the next president and everything that you brought today. We can't thank you enough. And to everybody that's on, thank you for being here. We're just excited that you're all coming and joining us for this conversation. And the conversation is important, but the action is what matters. So I hope that everybody has taken something away from this that you can do in your work, in your communities. And we hope that you'll come back for episode 3. So that's next Thursday. We're going to switch gears a little bit. We're going to actually have a conversation about, as we continue this work of strengthening families, we still have a foster care system serving kids and families. And how are we going to make that the most equitable, just experience that we can for kids and families? And so that's going to be the conversation. I think you're going to get a lot out of it. We'll have Associate Commissioner Jerry Milner coming on to that conversation, as well as a couple parents with lived expertise. And we're going to have new co-hosts. Jaquaya will be with us. Sandra, thank you so much. We're going to have Carrie Richmond from American Academy of Pediatrics and Foster Strong come on and co-host with Jaquaya. So incredibly excited about next Thursday. You can share registration from our website with your colleagues, instituteforfamily.org. And we are also posting more content to keep this conversation going on our social media. So Institute for Family on Facebook, LinkedIn, Instagram, Twitter. So go there, you'll see Ned already there, Sharonda from last week, you can see her there. Perhaps somebody in the squares here today might show up as well, is our hope anyway. So I think that's it. We can wrap on that note. And to everybody here, thank you very much. And we'll see you a week from today.